everyone. So welcome to the class. So today we are going to continue with the lesson. Okay, so if you could take out your notes that I have given before. So the notes about use and abuse of drugs. So we're going to pick off where we left off before. Okay, so I will actually share the screen. Let me just get it. Right. So last time, sorry, let me just get my glasses. Okay. So last time we had discussed about the use and abuse of drugs. Okay, so we've looked at the definitions of drugs. We've also looked at the use of antibiotics as well as the effects of excessive consumptions of alcohol. Right, so that's what we learned so far. And today we are going to continue with the next part of the lesson. Okay, the next part of the topic, which will be, okay, so I'm not going to go through everything again, right? So which will be about tobacco, so cigarette smoke. Okay, so this is the next example of a socially acceptable drugs. Okay, but in this case, it would be, you will see how it's no longer regarded as a socially acceptable drugs. Okay, so firstly, we need to understand first, okay, why do actually people smoke? Okay, why do they start smoking? Right. So one of the reasons why people started smoking is because they might think that it would be a sign of adulthood. Okay, so people think that, okay, if you are an adult, then you should be smoking. Okay, so that's what the views were, which obviously is not true right now. Okay, and the second reason why people started smoking is because young people, they start smoking out of, see here, it means curiosity. Okay, so young people start smoking out of curiosity in order to experience what smoking is about. So in other words, they are just curious. Okay, so they want to know how it feels like, how it tastes like. So that's what curiosity is. Okay, but unfortunately, so it says here, unfortunately, cigarette contains drugs that are, this one is addictive. Okay, so cigarette contains drugs that are addictive, so smokers find it difficult to give up smoking. So what it means is that once you take it, they actually have a compound, they have a chemical in which it causes you to be addicted. Okay, so it's very hard for you to stop. So once you get it in, so it's very, very hard for you to stop. So that's what addictive is. Okay, and the other reason is simply because the young people, so we're talking about the young people, is they might start smoking simply because they want to imitate their parents. Okay, they see their parents or their older siblings doing it, so that's why they feel like they should be doing it. Okay, and of course it tends to be, so it has that value of a social pressure. Okay, so it's social pressure, so everyone is doing it, so I feel like I want to do it as well. So that's what it means there. So that's social pressure. In other words, in this case, if you're in a group of young friends, your own friends as well, and everyone is smoking, and then they ask you to smoke, and you feel like you are obligated to smoke. So that's what we call is peer group pressure. Okay, so your friend is kind of like pushing you in trying to smoke. Okay, so that's why people started smoking. So why they start smoking, and although we know about, I'm pretty sure that most people actually know the 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 the, the diseases. Okay, the harmful effects that are associated with smoking. But what tends to happen is that people find it very hard to quit smoking. Okay, they want to continue smoking even though they know what are the bad effects, right? And we need to understand why it is very hard for them to stop, right? And why do they continue smoking? So first point is that they believe that smoking is stimulating and that it relieves tension, depression, and even boredom. So what it means is a lot of people think that if they smoke, then it is good for them because it helps them to release tensions. Okay, it makes them feel good, it makes them feel relaxed, okay, which is actually not true per se, right? So we'll have a look at what are the effects later, right? And these are, all these relieving tension, depression, relieving depressions, boredom, whatsoever. Okay, we think that it's working not to feel all of these things, but actually all of these are actually what we call as psychological effects. Okay, so the ones that are highlighted means psychological effects, right? So psychological effects means it's just what your brain is thinking. Okay, it's not actually really making you less tension. It's not really, there's no other chemical things going on in your brain. Okay, apart from you are tricking yourself into thinking that it is, it is relieving your tension whatsoever. Okay, so it is just psychological effects. Because why do we know for sure it's the psychological effects? Because we know for sure that smoking and right, they cannot provide stimulation, because once you actually smoke, it actually stimulates your body. Okay, and if they are a stimulating agent, okay, at the same time they cannot be a relieving agent as well. Okay, if it's something that stimulates, something that makes you excited, okay, therefore it is not possible that something is exciting but at the same time is relieving as well. Okay, so at the same time relaxing as well, because once you're excited, of course you are not relaxed anymore. Okay, so it contradicts, right? Second point, why do people actually continue smoking, is it already has become a habit for them. Okay, so it becomes a habit. So it's very, very hard for them to, to break the habit, right? To break away from their bad habits, to, they keep doing it every day. And once you actually stop doing it, it feels like there's something missing. Okay, so they feel like it's very uneasy, right? The third point is cigarette is actually a drug. So technically, since they are technically a drug, so therefore they can become addictive. Okay, so this word here, they can become addictive. So they become addictive because they consist of drugs. Right? And people who actually try to stop smoking will actually develop what we call as withdrawal symptoms. So this, it means withdrawal symptoms. Okay, so what is it? Withdrawal symptoms. So withdrawal symptoms are the same symptoms that you experience when you actually stop doing something. Okay, and in this case, when you stop smoking, you will experience these kind of withdrawal symptoms. Okay, what are these symptoms? Okay, so it will be craving to smoke. Okay, you feel like you really, really, really need to smoke all of the time. Second, you become sleepless. Third, you have numbness feelings in your arms and legs, okay, in your peripheral, in your extensions. Number four, you feel like you can't do any work at all. And number five, you're coughing more than usual. Okay, so these are just to outline some of the withdrawal symptoms. Okay, it is not, by all means, these withdrawal symptoms, they are not exhaustive. Okay, so this is not all the withdrawal symptoms. There could be more withdrawal symptoms as well. Okay, sometimes you feel nauseous, you feel like you want to throw up all the time, you feel like, it's just, you feel uneasy, you feel ill, right? So those are what we call as withdrawal symptoms, right? And this is technically what is happening. Okay, what are the harmful effects of smoking to your body? Okay, aside from the psychological effects, right? Aside from the psychological effects that you think the cigarettes is making you, but in reality, what is happening is that the substances inside the tobacco smoke, okay, inside the cigarette, they have all of these harmful effects. Okay, so we'll have a look into the first substance. Okay, so there are actually thousands of different substances that you can find in cigarette smoke. Okay, but we're going to outline a few. Okay, and these are the ones that you need to know. These are the ones that you need to understand. Okay, so the first common one is what we call nicotine. Okay, so what do actually nicotines do? So number one says here, it stimulates the brain at first, making the smoker feel alert and relaxes the muscles. Later, it dulls the brain and the senses. So essentially, it's making your brain feeling, lose the brain's activity. Okay, they lose the senses, they dull your brain. So they are making your brain less active. Okay. The second point is, what do nicotine do? It actually causes addictions. Okay, so which substance in the drugs, which substance in the cigarette, which actually cause addiction? It is actually your nicotine. Okay, and once you actually stop, okay, and in the future, if you want to stop taking cigarettes, and then you will experience withdrawal symptoms. Okay, so the similar symptoms that we've looked at here just now. Okay, so those symptoms, and they may, and as I said, there may be more withdrawal symptoms as well. So number three, nicotine, apart from being addictive, is also, it makes your blood clot easily. So CLOT, clot. So what it means is, it tends to make your blood sticky. Okay, so it tends to make your blood quite sticky. So therefore, if they are quite sticky, so they will form like a ball, or like a ball, like a mesh. And if this actually gets stuck onto your blood vessels, then there would cause blockage. Okay, so therefore it increases the risk of blood clots blocking the blood vessels. So it's a blockage. Okay, so the clot causes blockage of the blood vessels, right? And if such blood clot, okay, so if the blockage actually occurs in the coronary arteries, so if the clotting, if it actually blocks the blood vessels which supplies to your heart, then what might happen is heart attack might occur. Okay, or if actually occurs in the capillaries in your brain, then a stroke may occur. So here, this is a stroke. Okay, so a stroke, it can lead to paralysis. So in respiratory paralysis, paralysis is lumpo. Okay, so it's 2 o'clock for the rest of your life. Fourth point. So apart from all of the effects, it also increases the heart rate by increasing the secretion of hormone. What's the hormone called? It is adrenaline. Okay, and as you know, the adrenaline will also contribute to the constrictions and leading up to the increase in your blood pressure. Okay, so we've seen this. We've discussed about adrenaline before, so it's the same thing as well. So it's just that nicotine actually causes extra adrenaline, okay, to be produced. The fifth is nicotine. Okay, cigarette smoke, as you should probably know already as well, but it doesn't just affect the individual itself, but it also affects, if, for example, you are a pregnant lady and then you are smoking, it will also affect the fetus in your womb, in your uterus. Okay, and there is actually a supply of a blood vessel which supplies nutrients from the mom to the fetus, and that supply is through a structure what we call as placenta. Okay, so the placenta is where all the blood vessels are found, and they will exchange nutrients between the baby's blood and the mother's blood. Okay, so here what happened is, if the lady is a smoker, is the pregnant lady is a smoker, so what might happen is that nicotine will actually causes, okay, there will cause the blood vessels, okay, the blood vessels in the placenta will actually becomes narrow. Okay, so in other words, sorry, let's just go back. Yeah, okay. So what actually happened is the blood vessels in the placenta, where the exchange of substances between the mom and the baby occur, they will actually become narrow and narrow and narrow. So it's makin sempit. Okay, so kalau ia makin sempit, so apa menjadi? So the blood supply to the fetus will be reduced. Okay, so the baby would have, eventually what will happen is the fetus, the baby, will have less and less supply of oxygen, less and less supply of nutrients, okay, which could be detrimental to the fetus health. Okay, so as a result, the fetus might not be able to what do you call that? To develop as fully as possible. Okay, and therefore it will eventually increases the risk of miscarriage, so keguguran, or what we call as stillbirth. So in the keguguran, dia beranak tapi anaknya mati once ia keluar. Okay, so we of course obviously no one would want that happens to their fetus. Okay. The second component of cigarette smoke, okay, that we'll discuss is actually carbon monoxide. Okay, so carbon monoxide is CO. Okay, you should know this. You should know that carbon monoxide is also present in the exhaust vehicles. Okay, kereta, exhaust kereta kami. Right. So what will happen is there will actually causes reductions of oxygen supply. Okay, so it will actually cause oxygen supply to your heart, to everywhere throughout your body to be reduced. Okay, because it reduces actually the efficiency of the red blood cell to transport oxygen. Okay, so it causes your red blood cells to not pick up oxygen. Okay, how do they do that? Okay, because we'll have it later how. Okay. Second point here, carbon monoxide will actually increase fatty deposits. So in other words, carbon monoxide ini ia membuatkan banyak fats, lemak berkumpul. Okay, lemak berkumpul, particularly which one? Cholesterol, arah mana? Arah walls of your blood vessels. So they will actually accumulate mostly inside the walls of the blood vessels. Okay, so surrounding the walls of the blood vessels. And if they accumulate, if they deposit into the walls of the blood vessels, then what might happen is that the walls makin basah, and as a result, the lumen, the pathway, the passage where the blood will actually flows will become narrower. Okay, so here, inner walls of the arteries causing the lumen to be narrower. So dia makin sempit lubangnya, pasal dindingnya makin tebal. Okay, and this can cause blockage in the coronary artery, resulting in heart attack. So as we discussed earlier, if you actually block your coronary artery, it may lead to a heart attack. Okay. And the third, okay, well, actually, this relates to the first point here. So we know that carbon monoxide reduces the oxygen supply to the heart. How do they actually reduce it? Because the red blood cell, okay, which contains the hemoglobin, will actually, the hemoglobin will actually combine with the carbon monoxide irreversibly. Okay, so in this case, so it puts here, combines irreversibly. So maksudnya ini dapat dibalikkan semula. Okay, so it's irreversible, it's permanently. So it's permanently bound with hemoglobin. So hemoglobin is where it's found in the red blood cells. Okay, so as a result, what will happen is that the red blood cells, the hemoglobin, will now carry the carbon monoxide molecule instead of the oxygen molecules. Okay, so usually they bind reversibly. Okay, they can easily associate and then dissociate with oxygen. Orang boleh ambil, lepas itu lepaskan oxygen. Ambil, lepaskan, ambil, lepaskan. Okay, but once they actually taken carbon monoxide, they can only ambil and they cannot lepaskan anymore. So as a result, no oxygen can now bind with the hemoglobin. Okay, so it's to form carboxyhemoglobin, increasing the oxygen supply to the fetus. Okay, so this is fetus. This problem will actually occur to do with the placenta, okay, supplying the oxygen supply to the baby. Okay, so if you don't have if you take cigarette which contains carbon monoxide, so they will bind irreversibly with your hemoglobin. As a result, there will be less hemoglobin in your blood, less oxygen in your blood, and therefore less oxygen can be supplied to your baby as well. Okay, and if there is less oxygen to your baby, so that means less development can occur for your baby. Okay, so your baby will probably become cacat or whatsoever. Okay, so or even worse, she or he would probably die. Right, next component that we're going to discuss is about tar. Okay, tar, the thing about tar is actually it contains cancer-causing chemicals. So here, it contains cancer-causing chemicals. So cancer-causing chemicals, in other words, we call it as carcinogens, right? So normally, what will happen is that cell division, okay, in a normal cell division should be controlled. Okay, so there would be time. So after some time, they should divide, and then after some time, they should stop dividing. Okay, but the thing is, with cancer cells, they cannot control when to divide and when to stop. So as a result, what will happen is that they will continue dividing non-stop. Okay, so and if they continue dividing and dividing, so they become a lot, they will actually form a mass of tissues. And this mass of tissues is what we call as the tumors. Okay, and this will actually lead to cancer. Okay, so here, normally cell division occurs continuously. Okay, continuously in the lungs to replace epithelium or membrane of the air sacs. So usually they will occur continuously. They want to replace any of the tissues that are damaged. So they will replace it. And in this stage, the rate at which they actually replace it, we should be controllable at a normal pace. Okay. And what might happen is this component, the tar, because they are cancer causing, so they are carcinogens. So what will happen is that if you have this tar, they will induce these cells. So what does it mean? It induce the cells, they will cause the cells, okay? They will make the cells to divide, but it will keep dividing at an abnormal rate. So maksudnya they divide very, very fast and they don't know when to stop, okay? So as a result, such uncontrollable multiplications of cells results in outgrowth or lumps of tissues, what we call as cancer or tumors. Okay? So actually, the outgrowth is what we call tumors. Okay? The disease is what we call cancer. Right? And as a result, if you have a lot of tumors, they may cause blockage of the air sacs, reducing the efficiency for gaseous exchange. Okay, so if these cells, the cells are dividing, they're making a lump. Okay, and as a result, this, for example, this is your trachea, your windpipe. So usually your windpipe, they will have a hole in the middle. So if the surrounding cells continue dividing, so the cell wall, okay, the walls of the trachea will become bigger and bigger. And if the walls of the trachea will become bigger and bigger and bigger, so as a result, the space in between becomes smaller and smaller and smaller. Okay, and if it becomes smaller, so of course, it will reduce the efficiency for gaseous exchange. So there will be less occurrences, less efficiency for gas to be exchanged. The second point here is it paralyzes the cilia. Okay, so cilia, if you still remember, cilia is the hair-like structure that are found lining along the airways, okay, lining along your respiratory systems, right? And this cilia, usually the function is they want to sweep up, okay? So if there is any particles that get trapped in between them, so they will actually sweep up towards your mouth, Okay, so in order for it to be you spit out or whether you want to swallow it, so it depends on the situations. Okay, but the thing is, if you are a smoker, so the tar will actually paralyzes the cilia. So in other words, the cilia is now they cannot sweep up anymore. So they become just, they're just there. Okay, dorang the cilia hindi lagi bergerak. Okay, ia lumpuh. So what will happen is this will prevent the cilia from removing dust particles from the lungs and trachea. So as a result, any of the dust, any of the bacteria that gets trapped, it will remain there. It will not be swept up towards your mouth to be spit away, okay, or to be swallowed. All right. So without the cilia, dust will be trapped by mucus buildup in the trachea and bronchi, and a persistent cough. Okay, so as a result, you might be coughing a lot. Okay, so you might be coughing a lot. Why do you want to cough a lot? Because you want to clear the airways. Okay, and because of all of these, the cancer causing, the paralysis of the cilia, as a result, it will increase the risk of respiratory diseases. Okay, so disease associated with your lungs. Okay, so such as your lung cancer, your throat cancer, as well as your mouth cancer. Right, and lastly is your irritants. Okay, so these it's a general grouping of certain substances which causes irritations in your respiratory systems. Okay, so these irritants could be the hydrogen cyanide or acrolein. So what do they do? What do the irritants do? Number one, it also contributes to the paralysis of the cilia. So they will make your cilia stop working, so they are not able to sweep up anymore. And it will also weaken the walls of the alveoli. Okay, so why do they weaken the walls of the alveoli? Because once it paralyzes, mucus accumulate. So what might happen is you try to cough a lot because you want to clear up the passage. And when you are coughing, you are actually putting a strain on the alveolar walls. Okay, so as a result, when you're actually coughing, the alveolar walls, they will expand and retract, expand and retract. And if you do this a lot of time, okay, if you do this a lot of time, then what might happen is the alveolar walls might break. The second point is the irritants, they may irritate the cells lining the air passage, causing them to produce mucus. Okay, so they will produce excessive mucus. Again, not the irritants themselves, but the cells. Okay, the cells surrounding your respiratory system. Okay, if they encounter these irritants, then they may produce excessive amount of mucus. Okay, and again, if they produce a lot of mucus, so your body will try to remove or to clear the airway. So as a result, you will cough a lot, okay, which will reduce the reduced gaseous exchange surface in the lungs. Okay, so as a result, if your alveoli breaks, then as a result, the alveoli wall is not functioning anymore. So therefore, you will have reduced efficiency of gas exchange, okay, because the alveoli wall now is no longer adapted, is no longer suitable for gaseous exchange. So as an overall, there will be reduced surface for gas exchange. Okay. The coughing breaks the weakened wall of the alveoli, causing a decrease in total surface area of the alveolar walls. Okay, so the coughing will break the weakened walls. Right, now we're going to look at the next point, which will be the links of smoking to other diseases. Okay, so what are the type of diseases that I usually link with smoking, the correlations? Okay, so if you see here, smoking may actually cause harmful permanent damage. Okay, so it means if you smoke, and it may cause some kind of dysfunctions to your organs, dysfunctions to your tissues, and this would be permanent. Okay, that means it's irreversible. You cannot undo it. Okay, once you smoke, it damages your lungs, and therefore you cannot fix your lungs anymore. Okay, you cannot undamage your lungs anymore. Okay, and if this happens, they will actually lead to the development of other diseases. So the other diseases, what are the types of diseases that are linked? Let me just give me a minute. Get my charger. So where was I? Oh, okay, right. So there are diseases that are associated, normal diseases associated with smoking. Okay, the ones are directly related with smoking would be all of these 1, 2, 3, 4, 5. So there are 5 common diseases related to smoking. Okay, so the first one is lung cancer. So okay, we've seen this above earlier. Lung cancer, emphysema, heart disease, cirrhosis, and asthma. Okay, so we're going to have a look at each of these. What are they? Right, so lung cancer. So as I've discussed earlier, cancer, what is a cancer? So it is essentially a condition whereby your cells is growing uncontrollably. So it's growing out of proportions. Okay, so they produce more and more and more, even though they are supposed to stop, they cannot stop. They keep growing, 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 growing. So therefore producing a mass of tissues, a mass of cells, okay, which what we call as tumors, right? And what is causing this? Okay, the leading cause of death due to cancer is cigarette smoking. Substances that cause cancer are what we call, as you should know this earlier, as carcinogens. Yeah, and an example of a carcinogen is a substance what we call as benzopyrene. So benzopyrene is a deadly carcinogen present in tobacco. Okay, so it's present in tobacco, causes cancer cells to be produced in the lungs. So it's making normal cells to switch to cancer cells. So they're making the cells defective. So they are not able to control their cell divisions anymore. Right? And also, tar and resin contain substances that act as promoter and help cancer cells to grow faster. So not just this substance, benzopyrene, which is a cancer-causing, again, it's carcinogen, but there are certain substances that are found in the cigarette smoke, which are what we call as tar, as well as resin, which act as a promoter. So in other words, they help to enhance cell division. So they are making the cells divide faster and faster and faster. Okay, so as a result, the tumor will actually grow bigger and bigger and bigger in a very short amount of time. Okay, so it's very fast for the cancer cells, for the tumor to grow bigger. Right? And lung cancer patients will develop shortness of breath. Okay, so as a result, it will be becoming harder for them to breathe, and they will cough up mucus and blood. Okay, they will batuk berdarah. Okay, and they tend to lose strength and body weight. Okay, simply because they are not able to efficiently exchange oxygen, exchange nutrients, particularly oxygen and gases in the lungs anymore. Right? Then next disease is emphysema. Okay, so what is emphysema? Is a disease caused when alveoli, okay, that is a disease caused when alveoli in the lungs do not function properly, causing ineffective gases exchange, resulting in shortness of breath. Okay, so what it essentially is, it's a disease related to your alveoli. Okay, so what actually happens is this. Okay, this is due to the partitions between the alveoli walls. Okay, so this due to partition between the alveoli walls break down due to intense coughing. Okay, so here it's break down due to intense coughing. So maksudnya dinding alveoli walls itu pecah. Pecah pasal apa? Pecah pasal kamu batuk habis. Okay, coughing. Let me just think what is E. E, the airspace, and decreasing. E, airspace. Enlarging, okay? So this will end up to enlarge the air spaces and decreasing the surface area. Okay, so when the partitions of the walls become, the alveolar walls break, so as a result, the airspace becomes bigger. But although the airspace becoming bigger, which is a good thing, but as a result as well, it also reduces the surface area, the number of doors for the exchange of gases. So that's where it's become less effective. Okay, so that's for emphysema. The third is a heart disease. Okay, so heart disease. What are the components? So the components of cigarette smoke which may lead to heart disease is nicotine and carbon monoxide. Okay, so nicotine and carbon monoxide in cigarette smoke are major factors causing heart disease, and smoke causes blood to clot easily, damages the wall of the blood vessels, and increases the fat deposit on the walls of the blood vessels, making them narrow. If blood vessels are blocked, blood flow to the heart is interrupted and a heart attack may occur. As a result, the heart has to pump harder to force the blood through a circulatory system, and the carbon monoxide decreases oxygen content in the blood by combining with hemoglobin more readily and reduces the amount of oxygen reaching the heart. Smokers tire out more easily than non-smokers. So what's it saying there? Okay, so essentially what it's saying is this nicotine and carbon monoxide, they will lead to the development of heart disease. How? Because number one, both of these substances, they may cause clot to form. Okay, your blood clot to form, and if there is a blood clot forming, if they travel to a small vessel, then it will block that small vessel. And if that vessel that they are blocking tends to be coronary artery, then it may lead to heart attack. Okay. Also, nicotine and carbon monoxide also causes fats to be easily deposited around the blood vessels wall. Okay, so if they cause a lot of fats to develop here, so as a result, the walls is becoming thicker and thicker and thicker. And if the walls is becoming thicker, and as a result, the pathway, the lumen will becoming smaller and smaller and smaller. Okay, and if it gets smaller, and then combined with the clot, okay, so it's the chances are that the clot will easily block the blood vessels, which are becoming thicker now, okay, or becoming narrower. Okay, the lumen is becoming narrower. Okay? And all of these will actually lead to the development of a heart attack. Okay, if it happens towards in your coronary artery, if it happens in your capillary, in the capillaries going towards your brain, then a stroke may occur. Okay, and if a stroke occurs, then you will get paralyzed. And next is cirrhosis. Okay, so what is cirrhosis? Cirrhosis is essentially kind of like, you know, a cut, okay, a bleeding. The substance in smoke, such as tar and irritants, interfere with the working of the cilia, resulting in dust and germ entering the lungs. Lungs produce lots of mucus or phlegm, P-H-L-E-G-M, phlegm. okay, enos, that causes smokers to cough continuously in order to clear his air passages. And this also makes his lung more likely to be infected by bacteria. Okay, and this causes redness and swelling of air passage and results. Is it bronchitis? Bronchitis, sorry. Okay, bronchitis and the results. Right. So what's it saying here is basically you have tar, you have irritants. Okay, they causes the cilia to be paralyzed, so you are no longer able to sleep up. As a result, bacteria will build up in your respiratory tract, and if bacteria build up in your respiratory tract, so what might happen is that your respiratory tract will become inflamed. Okay, so they will become inflamed because they are infected by bacteria. Okay, and in these conditions is what we call it as bronchitis. And lastly is asthma. Asthma is caused by that narrows. Where is this? Asthma is caused by that narrows the airways in the lungs. Forgot. Okay. Well, I'll let you know in the WhatsApp anyway. Okay, I'll let you know later. I'll look it up what this is. I forgot what it is. Okay, so asthma is caused by something that narrows the airways in the lungs. Sudden constrictions of the air passages reduces airflow to alveoli. Oh, sorry, caused by alveoli. Oh, yes. So asthma is caused by alveoli, or the air passage that alveoli that narrows the airways in the lungs. And sudden constrictions of the air passages reduce airflow to the alveoli, making breathing difficult. It is caused by the irritants. Okay? So in other words, the irritants will causes the alveoli, the passage to become narrower and narrower. So therefore, it's very hard for you to breathe. Okay, so this is the effects. So earlier we've looked at the diseases related to the individuals, diseases related to smoking, what happens to the individuals. Okay, we've discussed that. And these are the pathways how the smoking will actually affect the fetus. Okay, so I've discussed this earlier, so I'm just going to go through very briefly, very quickly. Okay, so as you know, they have nicotine. So what do nicotine do? Increases fatty deposit in placenta. Okay, so what will happen? Placenta blood vessel will narrow. So as you remember, placenta is the vessels, is the structure where the exchange of gas, exchange of nutrients occur between the mom and the fetus. And as a result, it will restrict blood flow through the placenta, so less oxygen and nutrients will pass through. So in other words, less oxygen, payah babynya dapat makanan, payah babynya dapat oxygen. Okay, so eventually it may disrupt the baby's developmental process and growth, and it will increase the chance of miscarriage. Right, so that's the pathway for nicotine. If you look here, the pathway for carbon monoxide, so what will happen is they will combine irreversibly with hemoglobin. Okay, and if they combine irreversibly with hemoglobin, then it means that there will be less oxygen for the hemoglobin. Okay, so less oxygen to combine with the hemoglobin, and as a result, less oxygen will reach the placenta, less oxygen will reach the baby, and therefore increases the chances for miscarriage. Okay, simply because the baby is now suffocating. They don't have enough oxygen no more. Okay, so here we're going to look at why do the society no longer regard smoking as socially acceptable. So, okay, so based on what we've discussed, all the diseases associated, okay, so it should make sense to you now why we consider it no longer as socially acceptable. Okay, it's no longer a good idea. It's no longer cool. It's no longer a social thing. Okay, it's becoming more and more of concern. Okay? People will tend to look down on you if you start smoking now. Okay, why? Okay, because now statistics and scientific evidence about the harmful effects of smoking has made more people aware of the dangers of smoking to health. Okay? So now we know that the effects, the diseases associated, so a lot of people are aware of it. So once people are aware of it, so they're trying to avoid it. Okay. There's also evidence that smoking not only affects the health of smokers, but also the health of the neighboring people in close contact with smokers. And this is known as a second-hand smoke or passive smoking. So passive smoking is essentially what it means is, what it's saying is that there are dangers not to just the smoker themselves. If you're smoking, it's not just bring dangers to you, but you also bring dangers to the surrounding people. Okay. In fact, they would be in higher risk, they would be much more dangerous for the second-hand smoker, the passive smoker, the people around you, as compared to you. Okay, so don't start smoking, right? Because what will happen is that the second-hand smoke can also cause heart and lung disease, and it can affect fetus in the pregnant woman. Okay, so it's not just affecting the diri kamu, it also affect fetus arah bini kamu, okay, arah pregnant woman. Okay, even though if the pregnant woman itu ia in the smoking. Okay? So therefore, smoking is no longer fashionable. In fact, in many parts of the world, smoking is no longer socially acceptable. Now, the law is protecting the right of non-smoker to clean air in many public places, including schools and offices. Okay, so a lot of places now, are in favor of discrediting smokers. Okay, they don't want smokers to be around. Okay, because we know now what are the diseases associated, the risk that they carry. Okay, not just for themselves, not just for the smokers, but also to surrounding people as well. Okay, and last but not least, okay, we're gonna go through, here. Okay, so we've looked at medicinal drugs, we've looked at socially acceptable drugs, which are alcohol and cigarette smoke, okay, which obviously no longer regarded as socially acceptable. And lastly is the drugs, the harmful drugs, okay, the illegal drugs. So here, medicinal drugs such as antibiotics or painkillers and alcohol are not considered as harmful drugs. However, when people start abusing the drug, such as taking the medicinal drug excessively or not under doctor's prescriptions or medical supervisions, or taking the drugs not for medical reasons, it can then become harmful, okay, because it abuse drugs. Okay, they abuse the drugs now. Okay, so usually most of the medical drugs that we have is usually tends not to be harmful. Okay, I mean they have the capacity to be harmful, but only if you actually take them excessively. Okay, if you take them without any medical control, without any medical supervision, so you're just taking it just for the sake of it, just you like it. So that's when it becomes dangerous. Okay, and you don't need to know all of this. Okay, you don't need to know what stimulant depressants are, just the general thing, because I have it here. Okay, so I'm going to go through briefly. So that, okay, you can divide drugs into 4 different categories. Okay, first is what we call stimulants. So stimulant is, from the name itself, is any drugs which causes you to be stimulated, to be excited, to be aroused. Okay, and obviously it will affect your central nervous system. okay, your nervous system, your brain, spinal cord, or whatsoever. Okay. And these stimulants, since they are something that excites you, so they will speed up your body's processes. Okay, they will speed up, they will increase, they will speed up your heart rate, they will speed up, they will your breathing rate as well as your blood pressure. Okay, and if you are taking these drugs, these stimulants excessively, they will make you a bit more jumpy. Okay, even though you are very tired, perhaps you haven't been sleeping for 3 days, and you keep taking the drugs, and then your body is actually very tired. But because of the stimulants, because of the drugs, it's making you jumpy all of the time. Okay, it feels like you have energy, but apparently you don't. Okay, so it makes you a bit more jumpy, a bit more nervous. Okay, and these are the examples of the drugs. Okay, amphetamines, which are used to counteract depressions or fatigue, as well as nicotine and caffeine as well. Okay, the normal stimulants that you are probably familiar with is nicotine and caffeine. Okay, your tea, your coffee. Okay. So those are the stimulants. Next is your depressants. So depressant is the opposite for stimulants. Okay, so kalau stimulants, it's making you jumpy, it's making you alert. Tapi kalau depressant, it's making you relax. It's making you slow down everything. So it will help to slow down your heart rate, slow down your temperature, slow down your respiratory system. You know, it's making you relax, it's making you slow down. It's because it's a depressant. Okay? And usually it is used to treat insomnia and tension. So sometimes some people who have troubles with sleeping because they think a lot, okay, they think a lot, they feel very nervous and so on and so forth. So we may prescribe them with this depressant drug. Okay, so the type of drugs, the group of drugs is what we call barbiturates. Okay, so it's a type of depressants that helps you to relieve your anxiety, okay, to make you feel a bit more relaxed. Next is hallucinogens. So these drugs cause abusers to see, hear, and feel things that are not existent, and they lose sense of time and space. Okay, so the drugs that cause you to be high out. Okay, so you eat, not eat, but you think that you are seeing something, you're hearing something that's not there. Okay, so example now is cannabis and LSDs. And last drugs is the narcotics. So these are drugs that are used for strong painkillers and cause sleepiness. And they are very, very addictive. So example, yeah, could be, okay, they are used to kill pain. Okay, supaya inda rasa sakit. Okay, usually this is used for medications. Okay, especially after you have surgery, that they may give you some morphine. Okay, a dose of morphine because it helps you to not feel the pain. Right? And the example of harmful drugs that we are going to look at is heroin. So heroin abuse is one of the biggest abuse problems in many other countries. Abusers may be hooked after daily use just for 2 weeks. Initially, heroin will dull the senses, giving a feeling of well-being. It reduces hunger, relieves tension, and makes everyday the user sleepy. Heroin is made out of morphine and is 2 or 3 times stronger than morphine. It can be inhaled, injected, or smoked, and its effect includes all of this. Okay, but here, okay, so essentially, so I'm pretty sure you have heard of heroin before. So heroin is very, very addictive. Okay, if you keep taking them only for a few days, okay, I mean, it's just only after 2 weeks. Okay, so only after 2 weeks, then you'll become very, very addicted. Okay, it's very, very hard for you to stop. Okay, and The way people will take heroin, it may vary, but it could be inhaled. You can inhale them using your nose, you can inject them, or you can use smoking. Okay, you can even smoke them, and that's for heroin. And the effects, yeah, it may cause decreased alertness, hallucinations, nausea, vomiting, temporarily sterility in impotence, unconsciousness, and death. Okay, so as you can see, all of the effects here, okay, they are not pretty. Okay, so it will, you can see why is it very, very dangerous, why is it illegal to take heroin, okay, because of all of these side effects. Okay, and of course, similar with smoking as well, if you are a heroin addict and suddenly you wish to stop, okay, you will experience what we call as withdrawal symptoms, but it will be much worse than it is to smoking. Okay, but I'm not saying smoking is better, but I'm saying is that it will be 2 or 3 times worse. Okay, the effects, yeah, the withdrawal symptoms. Okay, so here, the danger of this drug is that the user becomes rapidly addicted. Okay, addicted or addictive, and needs an increasingly larger dosage to produce the same sensations. Okay, so the thing is, once you inject, let's say hari ini kamu inject 5 milliliter, and then 5 milliliter, you become high. The next day, you inject 5 milliliter in the high, in the positive, tambah lagi 5 milliliter, so jadi 10 milliliter. So the next day 10 milliliter, baru kahya. Then the next day-nya lagi 10 milliliter in the high, and then tambah lagi 15. So on and so forth, so that you need to keep increasing the dosage. Okay, and once you become physically dependent on the drug, okay, you want, you always want to be high all the time. So therefore, it will come to a point that you feel like you are physically dependent. Without the drugs, you can't function, you can't do anything at all. Okay, so that's when we know that you are now an addict. Okay? And of course, as I mentioned, a regular user who stops taking heroin will experience severe withdrawal symptoms. Okay, so the same kind of symptoms, but even worse to a much worse degrees. Okay, and sometimes the degree of withdrawal symptoms, how bad it would be, it can even lead to death. That's how bad it is. Okay, so it will cause anxiety, it will cause chills, it will cause sweating, nausea, watery eyes, goose pimples, stomach cramps, hallucinations, all of these things, and might be even worse, could lead to death. Okay, because their body becomes physically dependent on the drugs now. Okay, so please don't try to do all of them. Okay, jangan tahkan menjadi addict. Right, so what are the problems created? So of course, this is quite straightforward. Okay, so I'm just going to go through very briefly to go through the answers in the boxes. Some people become dependent on heroin because their addiction is too strong. Heroin addict will pay a large amount of money for the drug, and since most addicts are unable to hold steady jobs, they must steal in order to get enough money to buy heroin. And heroin addiction creates crime problems as well as health problems for the addicts. Okay, so it's a slippery slope argument. Okay, it's a slippery slope argument. Okay, we're saying that, okay, if you are an addict, you become dependent. If you become dependent, then you might commit crime. Okay, because you can't do you can't have your jobs anymore. Okay, because you're always dependent, you're always high. Okay, so you might get fired. You might get fired, and then therefore you have no money. If you have no money, then you need to find money to buy your drugs. Okay, therefore it creates crime, it creates all other, nasty crimes, all of those stuff. Okay, it's a slippery slope, but it could happen. Okay, and that's what tends to happen. Next is also the problem that it is very difficult to cure. So obviously, so many methods have been tried. A legal drug, methadone, is used as substitutions for heroin. So there is a type of drug which we think it's a bit slightly better compared to heroin. So we use it as a substitution for heroin, what we call is methadone, and they can spare the addict from the agony or suffering from the withdrawal symptoms. Okay, so if you take this, okay, if you take this instead, then it could be that you will not experience any withdrawal symptoms. Okay, or at least it may not be as severe as if you are taking the heroin, but it will not cure the addictions. Okay, it does not cure addiction. So you will still be dependent. You will still want to have the methadone all of the time anyway. Okay, but at least it will not make it you feeling high. So therefore, you can still technically you can still or rather arguably you can still hold a steady job and function normally. So you'll probably have a good time with your family, good time, at work. Okay, you still can function, do your own work, but the thing is, it's just very, very addictive. Okay. So next is danger to infections. So of course, if you are taking the heroin, you become addicts, and they will usually inject the drug directly into the veins. Okay, you could inhale them, you could, there are several ways to do it, but most people will try to inject them. They use the syringe. Okay, but obviously the syringes, okay, not everyone can afford syringes, okay, especially for those addicts, okay, who might be poor, they don't have jobs. And the chances are they might probably just share the needles with other people, okay, or they just pick up any used needle from the hospital and they use it and do it on themselves. And the thing is, they don't know if the needles that they use is probably infected with any kind of diseases. They picked up any kind of diseases whatsoever, and it leads to some kind of infections. Could be HIV, could be AIDS, or whatever. Okay. So here, the needles may share, maybe the needles they share may be unsterilized and gets contaminated, thus resulting in transmission of diseases such as hepatitis B and AIDS. Okay. And lastly, there will have social implications. So they will have you become a liability to society. Okay, so you become you're just a trash to society. Okay, so family life is often disrupted because an abuser's life is dominated by the needs to obtain drugs. So usually, they want to get the drugs. They don't really care about their families anymore. They're kira anaknya, mamanya, bapaknya, bininya semua asal dia berguna, asal dia dapat dia punya dadahnya saja. Okay, and the abusers prefers to be alone or with other drug abusers. They lose interest in giving or receiving affections, so they tend to be very antisocial. Okay, they are. If kalau dulu maybe the person is very, very active, very, very a social butterfly, likes to go out with everyone, but suddenly if he or she becomes addicted to heroin, then that person may become reclusive. Okay, but of course, this not necessarily means that everyone who's introvert, reclusive is an addict. Okay, but it could be. And this may result in violence and insulting others, and drug abusers are not able to contribute to the country's economy. They become useless member to society. So they become a liability. So orang menjadi masalah kepada negara kita, okay, to all of society. Right? I think that's all. Okay, with that, and just double check. Yeah, so with that, I think we have finished the topic. Okay, so you see there, okay, we should have covered all of the outcomes. So we've discussed about drugs, what are the definitions. We've discussed about the medicinal use of antibiotics, okay, medicinal drugs. We've also discussed about the socially acceptable drugs and how they are now no longer socially acceptable. The effects of smoking, the effects of alcohol consumptions, as well as heroin. Okay, and what are the pathways, how they can lead to certain type of diseases, how it may affect the fetus, how it may affect everyone else. Okay, so that's, yeah, so I think that's all that for now. Okay, so at the end, as you know, that at the end of the lesson, we would usually would have some kind of test. Okay, so I'll probably put up a test sometime next week. Okay, so for now, thank you for listening. So have a good day. Bye.